Alright, so I'm going to do a heart exam on my patient here. So first I'm going to start with some inspections. I'm going to be looking at his hands and nails. So checking them out, flip them around for me, pretty cool. Alright, so you're looking for any abnormality there. Then we're going to go to inspecting the jugular venous, the jugular vein here. So we can inspect it while he's, I guess we could do it while you're laying down as we did in lab. So I'll have my patient lay down, supine, face up. And what I'm going to do here is grab my pen light and I'm first going to inspect it, where we could have him resist and see his two SCM heads, and then you go between the heads and between the clavicle in that triangle, and you're looking in that triangle for the little pulsations in the skin, and then you also can put tangential lighting to see that pulsation better. We will then move into looking at the chest for any heaves or any abnormal pulsations coming through the chest. And we can use tangential lighting once again on the chest to help us find those. And then we will move into the doing the right angle for the jugular pressure. So we'd have two small rulers, and what you would do here is you would put one at the sternal angle going vertical, and then you would place your second one at the where you get that pulse in between the two sternal heads and the clavicle, or the two SCM heads, and you would lay those across and you would see where it intersects on the ruler, and that would determine the height of it. And now we're going to go to, we will go into, we inspected the chest, and we will now palpate for any heaves or thrills. So now after inspecting the chest, we'll palpate the chest. So palpating for any heaves in the chest, making sure there's no abnormal pounding. And then you'd also go on each valve for the thrills. So start at the palmic and work your way across and down. And then from here we will use a knife edge on the chest for the heaves. So knife edge on the chest, especially if it was a female, this would be a better contact for barrier issues. And we will then move into auscultating. So I will first use the diaphragm and start at the aortic and move across and down following the A-pet monkey pattern. So, and then once I get to the bottom, I will flip it and use the bell. So I'm listening for any abnormal sounds. And then flip it and use the bell and go right back up. Listening for any abnormal sounds. We will then have our patient, we'll do the S2 split, so we will go on the, using the diaphragm portion, and we will go on the palmic. And we'll have our patient breathe in deeply and hold it. So breathe in deep. And you're listening for any abnormality there. And then we will do aortic regurgitation. So the patient will sit up for this one. And he's going to lean slightly forward. And I'm going to use the diaphragm at the palmic again. And I'm going to have him inhale and then exhale and then hold that exhale. So I'll have you breathe in and then out and then hold your breath out. And then we'll go into mitral stenosis. So we're going to have him on his left side down as he is in a sideline position. I will come on the back side of him, and I'm going to be using the bell at the mitral valve. So I will be behind him, reaching around to the mitral valve, and I will have you breathe in and then exhale and hold that. And you're listening for any abnormality there. And then we will also do the Valsalva. So he'll be in the same left sideline position, and I'll have him do the Valsalva, and I'll listen to the mitral valve once again during the Valsalva. So I'll have you do the Valsalva maneuver. And listening to any abnormality there. We will then palpate and listen to the apical impulse. So coming down to the apex of the heart, we will feel, we will palpate the pulsations. And then we will also listen to them. And that will do it for the heart exam.